Gentlemen, imagine waking up tomorrow with real morning firmness again. No pills, no pumps, no risky treatments. Just three simple points on your body, fully clothed, that reactivate the nerves and blood flow your erections depend on. I'm Dr. Emma, board-certified urologist. Stay with me. By the end, you'll know exactly where to press, how long, and how often to start feeling results. After 50, most men don't just lose testosterone. They develop what I call pelvic circulation shutdown. Stiff hip arteries, tight pelvic floor, and sleepy sacral nerves, S2 to S4, the control center for erections. Result: slower blood inflow, poor trapping, weaker morning firmness. The fix isn't guesswork. It's targeted neural priming plus vessel opening. That's what this circuit does. Erections are a reflex loop: brain to sacral cord, to pelvic nerves, to smooth muscle relaxation, to arterial inflow, to venous trapping. Age adds friction. Arteries stiffen, fascia tightens, nerves under signal. When we mechanically cue specific external points, we send a wake-up burst through sacral pathways and relax hip fascia so more blood can actually arrive. Think of it as taking the parking brake off your circulation. Safety: no pain, no numbness, no tingling down the leg. Breathe normally. If you have recent surgery, severe back pain, or neuropathy, get cleared by your physician first. Place your palm flat on your lower back, just above the tailbone. You're covering a triangle whose top corners are the dimples of your low back and whose tip is the tailbone. That's where sacral nerves that influence erections emerge. Stand or sit tall. Place one palm over the triangle, the other palm over it for gentle pressure. Hold 30 seconds, slow nasal breathing. In 4, out 6. Then switch to tiny clockwise circles with the heel of your hand for 60 to 90 seconds, just enough to feel warmth. You should sense relaxing, not pain. Why it works: warm, steady pressure here modulates sacral outflow, reducing protective tension around the nerve exits and improving the reflex signal that relaxes penile smooth muscle. The inner thigh groin line release. Sit. Slide your fingers along the inner thigh from mid-thigh toward the groin crease, but stay on the thigh, not the genitals. You'll find a slightly ropey band, the adductor fascia. Using 2 fingers, apply slow pressure and slide toward the knee for 90 seconds per side. Then perform 5 gentle presses, 2 to 3 seconds each, in the most tight, tender spot. Again, on the thigh only. Finish with 10 slow knee openings, butterfly motion, to let blood move. Why it works? Tight inner thigh fascia strangles pelvic inflow. Releasing this line frees the on-ramp for blood to reach the pelvis, supporting stronger filling in the morning. The ankle trinerve point. Sit. On the inner lower leg, find the bony bump of your ankle. From the top of that bone, go 4 finger widths upward, then 1 finger behind the shin bone. That soft spot is a circulation tripoint, near tibial nerve and vessel branches. Press with your thumb to a comfortable 5 out of 10 pressure, hold 45 seconds, and breathe in the nose. Ease off 10 seconds. Repeat 3 cycles per leg. Finish with 20 ankle pumps. Pull toes toward you, then away, to milk blood upward. Why it works? This point signals the autonomic system and encourages lower limb venous return, feeding pelvic inflow. Ankle pumps act like a calf heart, pushing blood back toward the pelvis. Putting it together, the 6-minute sequence. Sacral triangle, 2 minutes total. Warm hold plus mini circles. Inner thigh groin line, 3 minutes total, both sides. Ankle tripoint plus pumps, 1 minute total.
both legs quick cycle. Do it once daily, either before bed to prime morning reflexes or upon waking to catch the morning window. 5 to 6 days a week. Reassess at week 3. Enhancers you can add. Optional, still non-genital. Nasal humming, 5 breaths on exhale, before point 1, raises nasal nitric oxide, a natural vessel dilator. Warm shower to lower back and inner thighs for 60 to 90 seconds before the sequence. Softens fascia. 2 deep belly breaths between each point calms sympathetic tone, the circulation break. What to expect and timeline. Week 1 to 2, warm thin pelvis, lighter hips, occasional stronger AM fullness. Week 3 to 4, more consistent morning firmness, easier maintenance. Week 6 plus, better on-demand responsiveness as nerves and vessels retrain. This is not a magic button. It's a reflex retraining protocol. Consistency equals compounding results. Common mistakes to avoid. Pressing too hard. Numbness or tingling is a red flag. Rushing. Slow pressure beats aggressive rubbing. Doing it once and judging it. Give your body 21 days. If you want the printable one-page map of the 3 points, timing cues, and a weekly tracker, I've put it together for you. Click below to download the Nerve and Vessel Wake-Up Circuit Guide. No drugs, no devices, just your hands, your breath, and a plan. Start tonight. Your morning will thank you.